Hello and welcome to yet another episode of Rose TV. Today with us we have Shalu Chawla, who is the founder of Adhiryan Kaya. It's it takes a little time to get to pronounce it properly, but there's a very beautiful reason why it's called Adhiryan. Can you tell us what that is?
So, Adhiryan is actually, it means lucky, and then Kaya is skin. So, I would say it's lucky skin. Skin we touch has to be lucky.
And Shalu is a cosmetic scientist. And you don't actually meet a lot of cosmetic scientists out there. So, Shalu, can you tell us a little bit about what you do? And, just for a bit of clarification for our viewers, could you tell us how you differ from a regular, dermatologist or a skin doctor?
Sure. There is something called as dermatologist where they deal with medicines. And then there's something called as cosmetologist where they deal with cosmetics. Now again, cosmetics, you can divide it into making a pure chemical based cosmetic formulations, or you can have little bit of chemicals into the formula and add more of organics to it. But you do have some amount of chemicals in every kind of formulations. People like me are supposed to be into a research and development lab. But then I began my journey into, curing the diseases and formulating for specific diseases, which I have been doing it over the past 20 years. Out of that, like 13 years I was abroad and 6 years I've been in Bangalore.
Okay. So, you're talking about very specific diseases. So, which are the diseases or ailments that you specialize in?
So I have seen people approaching me most of the time for pigmentation, where it's a major cause for the young teenagers when they are having their puberty age, maybe 14 to 17, and then that is the zone when they get a lot of dandruff, dryness of the hair, acne, and then you get more of issues with the ladies who are touching their menopause. Around 40, 45, 37 onwards they begin with, and a main chronic disease what they get on their face is pigmentation. It's like a shadow kind of formation on your face. It could be little darker, it's a spread apart, it could be into dots, it could be a joint together, a big patch, and such kinds of diseases I have been. And then again you suffer with chronic acne, and then this is what I have been dealing with.
Chronic acne, I think I can think of at least two people in this room right here who would suffer from chronic acne. So, how do you go about, treating your clients?
So what I do is for me, it's always been a journey where I have learned over the patient.
Mm-hmm.
With my qualification, I know that qualification, I have a degree behind me, but then I have learned everything on my patients through my journey. So what I have realized is every person, they are suffering with different diseases. So what I judge them is their age. Mm-hmm. And definitely their hormonal changes are definitely there. That's a major cause. Internal is the major cause they suffer from.
Mm-hmm.
But then yes,
internal in the sense,
internal means they might have hormonal changes, imbalances in their body, diet, so many factors affecting them. But yes, to my knowledge, as per in 20 years, you can treat them superficially. You do not need to eat anything to bring them out of that disease.
When you say superficially, can you give me an example of how it can be treated?
Suppose the biggest problem nowadays with ladies is pigmentation, I would take, or an acne spots, or acne marks. Mm-hmm. So what do we do is we start seeing that a person definitely most of the time are suffering from dryness. Mm-hmm. So what happens is the level of the oil start going down. In the body, on the skin, so it goes down the layers. So now you see the skin has started getting dry, and then the external factors start affecting them. Maybe it could be sun, it could be another aging, it could be so many, and the water is getting drier from outside. Also, your skin has started getting drier and drier and drier. You start getting those pigmentation, melanosome starts getting active. Mm-hmm. Which we already have, but then they start acting on a patch, which could be in any part of your body. Mostly it is on the exposed part of your body. Could be your half hands, could be your face. Mm-hmm. So we start working on them. I start building up the level of oil inside, covering up a layer of oil on top with an SPF and a cream which is multiple emulsion base, which penetrates into deep into your skin, and we start removing the shadow out of your face, which is a pigmentation form. So that is how I treat 3 different ways and bring a person out of it.
Yeah. So, we're very excited to announce that Shalu is going to be functioning and available for members of Rose and women who want to meet her via Rose. And this is going to be for the next 3 months, following which she'll probably be continuing or
Yes, of
going
course.
elsewhere, depending on where the wind takes her. But, Shalu, tell us, like, what can we expect from a consultation? Let me say I come for a consultation. So how would this be? How would we be going about with this?
See, when you can, and you will be meeting me in Rose
All the time.
all the
Shalu
time.
absolutely
I'll be
is
here,
very involved.
and maybe a week from now, you will be seeing me all the time in Rose. And
by appointment, though, Shalu loves to take appointments. So
yes,
please always make
I
an
would
appointment.
request for that. I do have other patients also, so I would request for that. And the thing is that when you come to me, I would be checking out for all the past history of your medication, any allopathy, anything, any treatments, anything you have been going through, any chemical peeling, any laser, anything. I need to know everything about it, and then I start taking it from there. I see the root cause of your disease, and then I start treating you. I take sittings. We will sit down and talk about how many sittings a month we can do or a week we can do. And every sitting, that's my assurance, you will be seeing a change in your skin for yourself, because I have a record of every treatment where you see a changes for yourself into every picture.
Mm-hmm. And just so everyone knows, what would your consultation fees be like?
I have yet to decide about the consultation part, because for me, I have always been more interested in treating a patient, and that can be told to you. I will be conveying it to Rose, and that can be told to you through Afsha.
Definitely, we'll put it up on the group and everything. So, Shalu, tell me, how did skin become something that you started working with? I know that you have a degree in cosmetic engineering. So, how did you decide to make this, your vocation, your career?
I really would tell you something. I would see ladies coming to me. They wanted to look fairer. They wanted to have a healthy skin. They didn't want makeup on top of their skin. They didn't wanted any. They just wanted the skin to be nude, and no, even a shade of a lipstick should be just a lip penetrator. Where even they do not wanted to put any lipstick. So then, and those people going into the office facing another crowd, and they would come back and tell me that, I've been looked upon like this. My friends have been told, my family members, to be honest, yes, family members, when they talk to them, oh, you have this problem around. And then when they used to come and talk to me, I started working on their skin piece by piece, a patch by patch. And I myself don't know how was I able to bring peace to their skin, and I would help them look more confident. And they were so happy that all through my life, it's through word of mouth. I have been getting lot of people. But other than that, my journey, I'm really interested. I want to see people and ladies looking very beautiful, and a confident skin. When they come out, they really talk confidently when they look nice.
Yeah.
So that gave me an entire idea, and everything inside me is built through my clients, my patients. They have encouraged me so much that I ended up motivating myself into a disease or a skin issue zone where I should have been a cosmetic scientist, where I would have been formulating a cosmetic cream, but I diverted myself into a treatment, and then my journey began. And you have to see how many prayers and well-wishers you have when you keep improving. This is what they want.
Absolutely, and it's like one of the things you said was that skin is the first garment that we wear.
Yeah.
And being able to treat that, or being able to have like a beautiful skin is very important, and it's a great matter of confidence as well. And Shalu, honestly, it's been wonderful to have you here, and I'm so glad we're going to be having you here for the next 3 months.
Thank you so much.
And what you do is invaluable. So thank you so much for doing what you do.
I hope I give justice to my words, what I have spoken here, and been doing it for past 20 years. I need more of well-wishers and people who pray for me that I'm able to help lot of
and
people.
You will. Thank you so much, and thank you so much for watching. We'll see you all here for your appointments with Shalu very, very soon.
Thank you so much.